Hi, my name is Dr. Lee Ostler. Thank you for visiting our Easy Instant Author website to learn more about the 21 Principles of Smile Design Instant Author project. I'd like to share with you a great idea that I've been using every day in my practice. It's fair to say probably that we're all looking for ways to increase case acceptance. One of the biggest problems to overcome in presenting our best recommendations in our treatment plan is to overcome the trust issue. Building credibility with our patients and having them trust us and the recommendations that we give them is really what case presentation is mostly about. One of the best ways that I've found to overcome the credibility or trust issue is to be an author, especially in the subject area that we want to excel at, which in our case would be cosmetic dentistry. In our society, authors are highly esteemed as being expert in the field that they write in. They have instant credibility simply by being an author. We take that principle and we transfer it into dentistry by helping dentists to become an author. The concept here is using a 21 Principles of Smile Design book, which we use in the exam room, the hygiene room, the reception area, the treatment plan setting, and so forth. Our purpose here is that we use this as a prop and as a tool to help educate our patient about the principles of smile design, as well as, most importantly, to help build our credibility and the trust in the eyes of the patient. We're trying to do this in just a few minutes or even a few seconds, and that's really all it takes. I'd like to just show you the setting that I use in my exam room where I use the 21 Principles of Smile Design book. Here I am situated in the exam room with the patient exam chair, with a computer monitor with a patient photograph on it, with a before and after photograph book showing before and after smiles, and with our 21 Principles of Smile Design book set here on the counter. The patient and I have already had an exam. I've tipped them up. We're now viewing the photographs of their images on the computer monitor. And we're beginning to have a discussion and a conversation about their situation. Very often the patient will make the comment about how they don't like a dark tooth, about how they don't like the gap or something else that's going on in their mouth. And very casually I just happened to mention to them that that problem that they pointed out is actually one of the very important keys of cosmetic dentistry and of smile design. And I'll say, in fact, it's such an important principle of a proper smile that I put it in the book that I wrote on that topic, the 21 Principles of Smile Design. I just kind of pull their attention to this, and I don't really say I wrote the book and puff my chest and sound arrogant or anything. I just make casual reference to the fact that problem that they have is one of the important principles, and I put it in the book that I wrote on that topic. And then I open it up and I just kind of fan through it so that they kind of get an idea of what the book looks like. And I will turn to the issue that they brought up. For example, it might be that their mouth or their teeth are not the proper size, or they're not in the best proportion, or there's a gap or something. So I'll turn to that part and I'll point to the pictures in the book and kind of briefly describe that. And if there's a second issue, I'll then turn to that one and talk about the gum line margin or whatever the principle is. And I'll make a few just real brief comments, and then I take and close the book and set it back down on the counter, and then refocus my attention back on their photograph and begin talking about them again. What's remarkable is what happens in this setting as I do that. As I set this back aside and focus back on their situation, it's almost like out of the corner of my eye, I'm watching them and I'm reading between the lines, and all of a sudden the context of the entire experience just changes in a heartbeat, because suddenly, because of my reference to the book that I wrote on this subject, I've become an expert. And I've had actually patients say, "You mean you wrote a book on this?" They're just taken back by that they're with someone who really is an expert, as is evidenced by the fact that there's a book. So this is the setting. Again, I don't put undue attention on the book. I just use it as a prop along with my before and after book, and it just rolls along as though it was not really a big deal. At this point in the conversation, we begin to narrow it down to their needs, their wants, but from that point forward, the entire context of the entire experience is very different. I'd like to thank you for coming to our Instant Author website and learning about the 21 Principles of Smile Design. On this website, you can learn a little bit more about the program and how it works. Again, the point is this can be your book. This is an easy way to become an author. We'd invite you to look at this. You have the opportunity to upload your photos, your biographical sketch, so indeed this really does become your book. This isn't meant for wide distribution. It's not meant for volumes of books to be printed. There's just a half a dozen or dozen books, if you'd like, that you'll be using within the confines of your own practice and with your patients in an exam setting or in a hygiene room setting where you're building your own credibility. Again, thank you for visiting, and please give us a call or contact us. We'd be happy to help you become an instant author the easy way.